hear a presentation from the team at Lawrence Hospital. We have Marianne Rittenhouse, who's a registered nurse, Dorores Powers, who's a physical therapist, and Kim Philbin, who's a registered dietitian. And the presentation today is about how to maintain joint health through exercise and nutrition and diet. So thank you very much for coming.
Thank you for having us. Hi everyone, thanks for having us. We're really excited about sharing some information with you. And to lead off, I'm going to have Dorores Powers talk to you about physical therapy. I'm going to start out by telling you she can't prescribe exercises, but she can make suggestions on how to keep your joints healthy through exercise, okay?
I need my clipboard. Hi everyone, welcome. Thanks for coming. Okay, so risk factors. Let's just talk a little bit about arthritis. And just the United States, the leading cause of disability is arthritis. 50 million Americans have some form of arthritis. So that's 1 in every 5 adults. Arthritis affects more than half the adults with diabetes and heart disease. So heart disease and diabetes are risk factors for getting arthritis. Another risk factor is age. Right. 50% of all adults over the age of 65 have some form of arthritis. The types of arthritis, there are different types of arthritis. Osteoarthritis, rheumatoid arthritis, gouty arthritis, and lupus also has a form of arthritis. So the smoking is a major risk for arthritis as well. Okay, obesity. Even 10 pounds, being 10 pounds overweight attributes to osteoarthritis. Smoking is a risk factor for arthritis. Nicotine is a vasoconstrictor, so the blood vessels get narrow, causing less blood flow to the joints, which causes a breakdown in the joint. Okay. Previous injuries to the joint, a lot of sports injuries, falls, traumas, car accidents, the joint involved in the injury develops a form of arthritis. Occupational hazards as well. Sitting a long period of time, driving, picking up heavy objects, lifting and bending, also predisposes you to arthritis. Genetics. People that have rheumatoid arthritis or systemic lupus in the family that you inherit from your parents also leads to arthritis. Okay, more females or males are prone to arthritis. Can anybody take a guess?
Why?
Females. More females get arthritis than males.
Why?
Right. Why? I don't know. But they do. Okay, infection and sepsis in a joint. When you get an infection in your knee, also leads to arthritis, breaks down the joint. It's called a septic arthritis. Okay? And a sedentary lifestyle is a big risk factor leading to arthritis as well. So sitting down and not getting up and moving will not help arthritis. Okay. Next. Next. How do I do this? Next.
How many people in this room have arthritis? Right?
Right.
I think everybody in here has something.
Sorry guys. We're going to have a lot of technical difficulties, I can tell. The computer's threatening to reboot. Just keep going.
So, most common areas affected by arthritis. Number 1 area is the spine. Most common area for arthritis is your spine. Where else? Our knees, our hips, our hands, and our shoulders. Did it go? It went. Okay. Ooh, preventing arthritis. What can we do to prevent arthritis? Decrease repetitive strain. Eat right. Hydrate. 8 glasses of water is the number. I also heard that A glass of water per 20 pounds of body weight is how much water you should drink. It's a lot, but the little you are, the less water you need. Maybe that's why I don't need to drink too much water.
Well, that's because your joints, the cartilage is made up of 80% water. It's a
Right.
spongy material, and it's 80% water. They should have given us instructions when we came out to shoot.
Exactly. So our discs in our back are also 80% water. The joints, our cartilage in our joints are, so you need to hydrate. Okay? Exercise and physical therapy, balancing rest with activity. Physical therapy can help arthritis to some degree. It can help alleviate symptoms by making our muscles stronger around the joint, protecting that joint. You can't just walk into a physical therapy practice. You need to see your doctor first and check with your doctor to make sure you're healthy enough for exercise or activity. We have certain modalities that could help alleviate the symptoms of arthritis. We have heat modalities like heating pads. Paraffin for the hands is a wax that surrounds the joints with warmth. Ultrasound, which is a deep heat that penetrates deeper into the skin to alleviate pain by bringing more circulation to the area and removing the bad byproducts that arthritis can attribute to the joint. Electrical stimulation as well to help break the pain cycle, to reduce pain in your joints. Massage that everybody loves, and ice. Most people, when they go to physical therapy, they're placed on a program, and once they feel a little bit better, they're discharged from the program. You have to keep doing the exercises that the therapist gave you. You should try to, I should practice what I preach, exercise every day. Moving is very, very important. Keeping your joints moving, keeping your muscles strong, keeping your heart going, keeping your circulation going is all very, very important. And if any of you have ever received physical therapy for any of your joints or back problems, yeah, it's very important to keep doing the exercises. Just because you do the exercises and take care of the problem as best you can doesn't mean you stop doing the exercises. And everyone's like, oh yeah, I remember the exercises the therapist gave me. Those are meant to be continued and done every day. Okay. Always ask your doctor first if you are okay for physical therapy. Usually an orthopedist or a physiatrist will write a prescription for physical therapy, and the orthopedist will be specific on what is the problem in your joint, and the therapist can work with accordingly. Usually when we do therapy as an outpatient or at home care, we try to heat the joint first, be with a little bit of exercise, a little bit of modality, and then ice after you've done all your exercises to cool the joint down, okay? Our 3 sets of 10 is the golden rule of how many times you're supposed to do the exercises, okay? And you should exercise once to twice a day, usually in the morning and in the afternoon or before you go to bed. And your exercise should be done 5 to 6 times a week. When performing an exercise, it should always be pain-free. If the exercise is hurting you, you stop doing that exercise. Maybe you're doing it improperly and need to tweak what you're doing. Next time you go see the therapist, you should tell them that, and they'll be able to help you with the exercise, or maybe give you a different exercise so that you're not putting stress on the joint and you have pain. Okay? Stretching. Stretching is very important before and after exercise. It increases flexibility, increases range of motion, and improves circulation. It's also a great stress relief, stretching. Okay, these are some sample stretches, but a lot of these are a little bit difficult to do. So the important thing, what I always think about when we stretch, is fighting that gravity, right? Gravity's pulling us all down. Okay, so here's gravity. Gravity is pulling us down. What we need to do, we need to stretch, is opposite of what our body wants to do, giving into gravity. So standing up straight, even sitting in a chair. Everybody sits at the computer and watches TV or reads a book, and they sit like this, okay? So every once in a while, sit up nice and straight. I see people sitting up straight, okay? Sit up nice and straight. Your head should always be over your shoulders, okay? Your earlobe should be over your shoulder, okay? Earlobes here, shoulders here. You should always try to stand up as straight as you can. Again, gravity is pulling us down and wants us to do this, okay? So standing up nice and straight and stretching is a great idea, okay?
How many of you go to the gym on a regular basis? Anybody go to the gym for stretching, yoga?
Oh, the wonderful exercises.
Oh, you exercise here?
Oh, they have yoga? Tai Chi? No, not yoga, Tai Chi? Tai Chi is wonderful. That's stretching and strengthening and balance all in one. And core activities, very, very good. Be careful when you do it. Make sure you're safe doing it if you can continue to do them at home, which is probably recommended.
We're having a lot of technical difficulties today.
You should have noticed.
The computer's actually going to shut down and I can't stop it in 7 minutes. I'm hoping there'll be a question and answer time with Dolores.
Talk real fast.
All right, okay. So some basic exercises I'm going to go into when you're sitting or when you're lying in bed, okay? And I always start from the bottom. Maybe it's my OCD. So what our ankles do? Our ankles bend and flex. Bend and flex. So stretch, pointing the toes up, push your toes down. You could do those when you're lying in bed. You could do those when you're sitting up. So that's a nice way to stretch. Up on your toes, up on your heels. Okay? Your knees, what do your knees do? Your knees bend and straighten. So when you're sitting in a chair, it's straighten and bend. Straighten and bend. When you're lying in the bed, it's bend and straighten. Okay, so this is stretching, range of motion, and strengthening as well. Okay, our hips, they bend and straighten as well. Same exercise. Lying down, bend and straighten. Sitting up, bend and bend. Okay? Our shoulders, very important. Shoulders and neck and back. When we're sitting, we always pull down this way, like I said before, gravity. Sit up straight and squeeze your shoulder blades back to open this all up. And you see how my head goes in the right position when I squeeze my shoulder blades? Well, so if I'm lying in bed, squeeze your shoulder blades back so that you stretch everything out in here. If you're sitting like this, or standing like this, or like this, you breathe better. If I try to sit here and take a deep breath, my ribs don't expand. If I sit up straight and take a nice breath, my ribs have a better expansion. Also your gut. If you're squeezing your gut while sitting like this or standing like that, if you straighten up, everything moves better. Okay? Your lungs move better, your gut moves better, your circulation moves better. Everything improves. Swelling in your legs from sitting too long. If you lie down flat and stretch, that will help everything stretch and straighten out. And it feels better. My favorite thing, which I should do, remember to do more at work, when I'm sitting, shoulders up, down, and all around. Up, down, and all around. Mine creak. Up, down, and all around. Up, down, and all around. And when you do that a few times, you automatically feel a little bit better. All that tension seems to release. Okay? Back exercises is different for every diagnosis. The therapist will have a diagnosis from the physician or help diagnose and appropriately prescribe exercises for stretching, usually stretching the hamstrings, and strengthening, usually your core. But there are certain considerations like spinal stenosis that you want to avoid some certain movements. Okay, so those exercises need to be specific from a therapist, of course. Walking. Walking prevents osteoporosis. It's wonderful if everybody can start a walking program, if your doctor says it's okay. So walking prevents osteoporosis. It's very hard in Tuckahoe because I'm from Queens, everything is pretty flat. Tuckahoe's a little bit hilly, but a good place to start walking, I tell my mother all the time, when you go to the supermarket. Say you have soda here, oh, soda, we don't drink soda. Say you have bread here and eggs there, or bread here and eggs here. You walked up and down every aisle until you get to where you want to go. And then, oh, I forgot my eggs. Go back and forth, up and down the aisles, just as an excuse to walk. Don't go straight from the eggs over to the meat and then go to the register. Take advantage of a flat, air-conditioned now in the summer area and just walk up and down the aisles. A shopping cart that's easier to move around with easier to make distance when you have something to hold on to. So up and down every aisle of the supermarket. The guys are going to hate me in the supermarket. But it's important that you get some kind of walking in. Yes? Yes.
The county has an exercise program. On Tuesdays and Fridays, you can walk in the Westchester.
In the malls, right,
Yeah.
right. I know some people don't go to the malls anymore. I find them very overwhelming, again, I live in Queens.
Well, it's early in the
But-
morning before they open.
Right, right, or even if you don't have, if you're no longer driving and you can't get to the
6 to
Westchester.
10 and it's free.
It's wonderful, it's a wonderful, wonderful idea. In the winter and in the summer when it's too hot, or in the winter when it's cold, you know, the mall is great, but your local supermarket is a good idea as well. Yes.
Lord Taylor doesn't know it, but I use them this hard winter. It's great.
It's true.
I live near them, and then you couldn't walk outside, so I went to Lord and Taylor.
It's true, but supermarket, you know, stores, just watch, keep your eyes focused and don't come with shopping carts, shopping bags all over the place, okay? It's important that you use good sneaker or good support. Flip-flops are notorious in the summer, or slip-on little shoes, or you can get plantar fasciitis just from not having proper support. Start 10 minutes a day if you can. If you can't, less. If you can do more, and gradually increase your walk. Okay, that's about it. Any questions? You know what, I just wanted to go over some fall prevention things. The big thing with seniors is, or younger than seniors, is preventing falls. Can anyone think of, we're going to talk about fall prevention on the stairs. Okay, what can we do on the stairs to help us not fall? Hold the banister. Turn your lights on before you go up and down the stairs. Okay? Put a non-skid surface on your steps. And keep areas where you walk nice and tidy. Don't put stuff on the steps. I always think this. Don't put stuff on the steps to go up if you know somebody's going to come down and they may trip on, you know, your socks or whatever that you put on the bottom step because you want to take them up later. Okay, very, very important that you look at your house as if it would be a danger trap. Okay, bathrooms. If you're thinking, oh, I should put a bar on the bathtub because it's easier for me to get in and out of, then do it. You don't want to have a fall in the tub because you never put that grab bar up. Okay, no skid mats in the bathroom. If you're prone to falling, put a chair, or sometimes even a folding chair inside the tub if you can't get a tub bench or a seat to help you bathe. I know it's a little scary sometimes when you're in the shower and people look up, they get a little dizzy. If you start getting dizzy just by looking up, or in the shower, think of putting a little chair or a little stool inside the shower so that you don't, run into trouble. Okay. Place things in the medicine cabinet that are easy to reach. If you're going to have your Tylenol, take it. Don't put it up there so that you have to reach and get off balance and fall. Bring everything down to eye level or hand level. Okay. Don't lock the bathroom door. If God forbid anything happened, you fall in the shower, you get a little dizzy on the commode or whatever, don't lock your bathroom doors. If you need to get help, people can come in. Never grab a towel rack. It's very easy to come off the wall. It's not supposed to be for a grab bar. So a lot of people say, oh, I use my towel rack. Be very, very careful with that. Get something that you know is going to stay in the wall and not pull off. Or sinks. Some people pull their sinks off too trying to get up. Okay? Keep your lights on. Keep your lights on. Keep your lights on. Bathroom, leave a little night light. Bedrooms also. Make sure there's a clear path to the bedroom. Don't leave a junky floor to trip over. Scatter rugs, be careful with scatter rugs. Wet floors, be very, very careful. I tell my patients to pull up all their scatter rugs because all you need to do is trip once and you're on the floor. Also, when you make the bed, please make sure the sheets are not on the floor. I have so many patients that come in falling because their foot got tangled in the sheets while making the bed. Kitchen, commonly used objects should be on the counter. Try to avoid reaching. Don't get up on a stool. Okay, we see so many people coming in because they stepped up on the stool just to reach their cup or whatever and end up, falling. Okay, quickly, what else? Avoid clutter. Avoid clutter is a big thing. I have a few handouts if anybody wants to take it home and look after. Fall prevention or any kind of prevention is the number one thing to help you. Next.
Good.
Any questions?
Questions, guys?
Yes.
Can we please get a copy of the stretching slides? Can you make copies of those?
You know what, I don't like giving specific exercises out because the way one person stretches, the other person shouldn't stretch. So this way you really need a physical therapist to show you how to stretch and show you what you need. So many people have so many different things. with your shoulders, you could have impingement, you could have rotator cuff, there are ways that you shouldn't be stretching. The basic things are posture, nice and straight, sit straight and stand straight for just basic stretching. And anything more specific, you probably need somebody to know what's going on with your particulars, okay? Any other questions? Yes.
I want to thank you for this.
The
I
jar
have a
opener.
story about this. It's the greatest thing going. I have one from Con Edison, I think, at least it looks like it, from 10 years ago from some group someplace. I have bought 5 in different stores in Westchester. They're worthless.
5 openers.
So I got only half of this left. This is the greatest
Oh,
ever.
it's the same
I
one?
can't open anything.
Even though it's a foot, it's used for, it's supposed to be for your hands, to open a jar. Right.
I use it for everything. I can't open anything anymore. It's great.
Yeah,
Thank you.
they're in your little packets, they're in your folders, everybody should have one, okay?
Any other questions?
Do we have any more folders?
Yes, we have more folders, and we'll make some, I know there's a lady over here that needs a folder, and we'll have to make a couple more. I was trying not to get in the way of our friend here. Next, sure.
Can arthritis be reversed, or you just
No.
relieving the symptoms?
No, you can help your symptoms, like Dolores said, like if you have bad knees, working on your quadriceps, going for physical therapy, and really working on your leg muscles to support the knee, but there's no cure for arthritis at this point. We're hoping someday, maybe stem cell, but no, there's no reversing it. And then, oh yeah, sure, go ahead.
I noticed a lot of postal workers, like mail carriers and the people that work in the platform.
Right.
They're walking constantly on hard surfaces.
Yes.
They end up with either knee or hip replacement.
It's true, and also the baby boomers now we're getting a lot of people in their 40s and 50s, really, I guess baby boomers were really 50s and 60s, if I was going to be honest. But because we started doing all the running back, remember in the 60s and 70s, running, jogging, aerobics, jumping around, and our joint, every time I go on the stairs, which is constantly, I can feel it in my knees. You're right, it's impact. Impact really affects the joints. Any other questions about that physical part of it? Because, oh, sorry.
You said physical, but we did discuss what you would think would be the best appropriate medication for.
Well, when I present at the end, that's what, because I'm the nurse portion of this thing, then we could talk about that. Yeah, because there are, yeah, we'll get to medications and all of that, and what I think and what I don't think. In the meantime, really great part of our presentation is the actual diet portion of this, where you can impact the inflammation by how you eat. And so Kim Philbin, who's a registered sorry, I just botched your name. Kim Philbin, like Regis, is going to talk to you about good diet choices and things that you can do, and you're going to be surprised at some of the things she tells you. So, thanks. Here you go. You should be fine.
Hello, everybody. So my last name is like Regis, but unfortunately, no relation. Okay, so I'm going to talk to you about, like Marianne just said, nutrition and joint care. So how certain nutrients and foods in our diet can help with our joints, okay? So how can the right foods help my joints? Foods that we eat throughout the day in our diet, what we incorporate, and adding certain foods can help us feel better and can help decrease pain caused by inflammation. So if you have any inflammation around your joints, these types of foods that we're going to go through can help decrease the inflammation that you're having and the pain that is associated with it. Two major nutrients that help decrease inflammation and decrease the pain that we're going to be talking about are vitamin C and omega-3 fatty acids. Okay, so vitamin C is an antioxidant and it helps in fighting the inflammation, so helping to decrease the pain like we just said. And studies show that a diet rich in antioxidant vitamin C supports healthy connective tissue throughout the body. And it's also involved in tissue formation, or collagen formation, which is the basis for connective tissues. So it helps provide support, maintain shape, and provides movement in the joints. Sources of vitamin C. Who here can tell me some sources of vitamin C from our diet? Orange juice, okay. What about oranges? Okay. What else besides oranges? There's more than that. Broccoli, okay. Cantaloupe, I heard. Okay. Good, good. Broccoli, cantaloupe, honeydew, oranges, mangoes, sweet potatoes, spinach, and collard greens. So all of these are excellent sources of vitamin C that if you incorporate into your diet, you can get the benefit of that, helping to decrease the inflammation. Oh, I'm sorry, mustard greens also. Okay, so omega-3 fatty acids are again a very powerful anti-inflammatory agent, so again helping decrease inflammation and pain. They're found in cold water fish like salmon, herring, mackerel, sardines, tuna. Walnuts, flax seeds, canola oil, and pumpkin seeds are also good sources of omega-3 fatty acids as well. And adding omega-3 fatty acid supplements from either flax oil or fish oil, I'm sure you've all heard of those, can also help reduce inflammation. But just as a note with any type of supplement, not just omega-3 fatty acids, you want to make sure that you speak to your doctor or a dietitian before starting to take any supplements, because a lot of them can interact with medications or interact with each other, or you might be over-supplementing. So it's just really important before you start taking supplements that you speak to a doctor first, because you may not really need to be taking that particular one. So just keep that in mind if you are already taking them, or if you're interested in taking them, make sure you speak to your doctor first.
I have a question.
Sure.
On the canola oil, I get very confused with what oils that we should use. I use olive oil and canola. What about vegetable? What is that oil?
Vegetable oil is so good too. It's really the saturated fats, like high fat oils, like coconut oil, palm oil. Those ones are really high in saturated fat. Extra virgin olive oil is okay. So just making sure you're getting the healthier ones. So like palm oil and coconut ones are going to be really bad. I don't really label anything as bad, but ones that we don't want too much of in our diet. Go ahead.
I want to ask you a question about oil too. What about grapeseed oil, and what is that used for? Grapeseed oil.
What is it used for?
Yes. It's certain things of cooking.
I can't think of anything off the top of my head of what specifically it would just be. Yeah.
Salad dressings. It's one of those new fancy oils that we're getting.
Supermarkets now.
It's you would probably use that in a salad dressing or something. I don't think you would cook with that.
Thank you.
Yeah, not for cooking.
Okay.
Yeah, no, you wouldn't use it to cook, right? Okay.
What about the fish? You just mentioned certain fish. What about codfish, haddock? They're generally caught in cold water too.
Yeah, there are other fishes as well that have other benefits. Those fishes that I just named are particularly high in omega-3 fatty acids, so those are the ones that are higher rather than other fish. So other important nutrients that are good for our joints are calcium, magnesium, proteins, and iron. So calcium and magnesium. Calcium is known for its contribution to positive bone growth and maintenance of bone density. And it works together with magnesium to promote efficient formation of bone tissue. Sources of calcium include dairy products, dark leafy green vegetables, and yogurt and fortified soy milk. And magnesium, seeds, nuts, legumes, cereal grains, and again, your dark green leafy vegetables. Protein. So your body needs protein to build healthy body tissues and maintain muscle mass. So around our bones, we have our muscles. And in order to keep our muscles nice and strong and healthy, we need to have protein or adequate protein in our diet. Good protein sources: lean poultry, fish, seafood, nuts, legumes, and seeds. However, you just want to keep in mind that having a higher diet in red meat, if you're eating a lot of red meat, it can trigger inflammation. So you want to cut back on the fatty red meat. So when you're going to the store and picking your meats out, you just want to look for a lean cut of meat. So trying to get the ones with all the fat around the trim. If you're doing ground beef, looking at the label for you want to see 90% lean meat, or it could be higher than that. Just not the ones that are really fatty. So that's something to keep in mind because it can trigger inflammation and work against what we're talking about. And when you do eat red meat, again, choosing those lean cuts of meat. Okay, so if you're a soy person, soybeans, tofu, and soy milk are 3 great sources of soy proteins that can help to reduce the pain and inflammation as well. Okay, carbohydrates and fiber. So whole grains are an excellent source of fiber. And a high fiber diet can again help with decreasing inflammation. So most of your carbohydrates should come from whole grains, vegetables, and fruits. So when you think about your carbohydrates that you take in, or your grains like your bread and your pasta and rice, you want to choose more whole wheat pasta, whole wheat bread, brown rice for that added benefit of the fiber, and less of the white. So half of your grains for your day should be from whole grains. So not that you need to cut out whites, don't want to say that, but at least half of your grains should be from whole grain sources. Okay. And I just said that. Bread, cereal, and pasta in your diet should be mostly 100% whole grain products. And just a note too, when you're in the store now, there's lots of different types of breads that you can buy. Some of them are marketed now as white whole wheat bread, or just it says whole wheat on it, or it says wheat bread, or multi-grain bread, or 7 grains. There's all different kinds of breads out there. When you're looking for whole grain, you want it to say 100% whole wheat on it. And if you look at the label in the back where you can read the ingredients, the first ingredient should be whole wheat flour. Some of them, if it says whole wheat, like white whole wheat bread or just whole wheat bread on there, some of them are bleached flour. So you really want to be looking at the label and if it says 100% whole wheat on it. So carbohydrates and fiber continue. Choose green leafy vegetables, brightly colored vegetables, and lots of fresh whole fruits. And a recommendation is that you should eat at least 5, preferably more, servings of fruits and vegetables each day. So a lot of us don't eat that. And people look at that and say, whoa, that's so much. But if you do incorporate it into your meals, like adding some fruit into your salad, or snacking on fruits and vegetables throughout the day rather than like a cookie or a piece of cake or a pastry, you can add it. It's not, and it's 5 together, so you don't need to eat 5 fruits and 5 vegetables. The recommendation is 5 total. So you can have like carrot sticks throughout the day, or if you like bell peppers, you can chew on those, or celery sticks. So there's lots of ways to incorporate it. You just have to push yourself to do it. Okay, iron. So iron is a mineral used in the body that helps in the production of red blood cells. Specifically, it's used in the production of hemoglobin, which is the main protein in our red blood cells. And hemoglobin carries oxygen throughout the body, so without the iron, the tissues, muscles, and other systems don't receive adequate oxygen, and they can't function properly. So having iron in your diet is important. And if you're not eating enough, you may feel tired and run down. Sometimes people, especially if you're anemic too, you need extra iron, so get that feeling of fatigue where you kind of feel like weak and fatigued. So having iron in your diet can help from preventing that. Who can tell me some sources of iron?
Spinach.
Spinach, okay.
All dark greens.
Dark green leafy vegetables, okay. Red meats, okay. Beans, okay. Good. So iron from meat, fish, and poultry is better absorbed than iron from plant sources. So the spinach, I know everyone thinks of spinach as a great source of iron, but actually from your meat sources, your animal sources, is where you're going to have the iron that's better absorbed. So you could still have the spinach. A good tip that I teach to our class on Wednesdays at the hospital is if you add some vitamin C with your spinach, it'll help it get absorbed quicker. So you can add, like, if you mix tomatoes with your spinach, or if you sprinkle a little bit of lemon juice, the acid, the vitamin C from the lemon will actually help you absorb the iron from the spinach better if you were to just have the spinach alone. Okay. Eating iron-enriched or fortified grain products such as cereals, pastas, and breads. If you are going to be getting, you can get the iron-enriched stuff too. So if you have not a big meat eater, or if you're a vegetarian, you can get iron from fortified products. Using a cast iron cookware can actually help you obtain some iron from that. And vitamin C can help your body absorb iron. So if you're taking an iron supplement or something and you drink it with a cup of orange juice, then it'll help it get absorbed. And coffee and tea can decrease iron absorption. So you want to limit your coffee and tea at meal times. Well, lots of people sometimes have coffee or tea with their meal. You want to make sure you have it after. Okay. So some other just basic tips for anti-inflammatory diet. Breakfast could be oatmeal. You can have it with fresh berries and walnuts with a cup of soy milk or regular milk. Snack on whole fruits, nuts, seeds, fresh vegetables throughout the day instead of those cookies and pastries like I said before. Adding that back in. I know we like cookies and pastries, but trying to limit that maybe to like your nighttime snack maybe for dinner, and really trying to incorporate more of the fruits and vegetables throughout the day. Eating more fish, less fatty red meats. Again, you want to focus on the lean meats. Staying away from deep fried foods and baked or stir fry your meals instead. So fried foods once in a while is okay, but trying to really focus mainly on maybe baking or grilling, stir frying, just because the frying will add that saturated fat. So it's high in fat, also can be high in sodium, which if you're trying to limit that too, something to keep in mind. And choosing green, orange, and yellow vegetables for your side dishes. You want to make your dish nice and colorful when you're having your meals, to get different sources from each items that you're eating. And drinking plenty of water, as Dolores said before. Keeping hydrated. And fresh 100% fruit and vegetable juices and herbal teas. With fruit juices, I like to say to have more of the fruit rather than the juice, just for the added benefit of the fiber from the whole fruit. But if you do choose juice, just making sure that it's 100% fruit juice and doesn't have all of the added sugar, because it can be very high in sugar. And those are just some references. Who has questions? I'm sure there's plenty. Go ahead.
How do we know how much inflammation we have in the body? Is CRP, is that the only test?
Well, I mean, yeah, you can, there are other things. You can have SED rates, there are different blood tests, but, you know, really for inflammation in terms of joints, it's what you feel. It's really what you feel. I mean, you don't really have to have blood tests to know that you have arthritis. It just depends on how debilitating it is, and then you would see a rheumatologist. I have a question. Do vegetable juices count, like I don't like to use product name, but like a V8? Does that count as a vegetable and fruit serving or not?
It can. Just for basic vegetable juice, like a V8 can be really high in sodium. So if anyone's trying to cut back on their sodium intake, with the juice you have high sugar, with the vegetable juices you have high salt. They do have low sodium V8s now, which I would say is the better option. And again, with the juice, 100% fruit juice. So you can work around it, but you still can have benefits from the juices as well. Yes.
On gluten-free products, is that just for people who have celiac health issues or liver issues? And is starch taken out of the gluten-free products? Is that what it is?
No. So there's a big thing going on right now as gluten-free being used as a diet plan. Sources are saying that it can help lose weight and it's not as high in carbohydrates because it doesn't have as much starch. And I actually just did a nice presentation on gluten-free being used as a diet. So gluten-free is only good for people who do have celiac disease where they have, they're completely allergic to gluten fully. There's also things like where you have gluten intolerance, where you don't have celiac disease, but you do have an sensitivity to gluten or to wheat. The gluten-free products are not less starchy, they just don't contain the gluten that can harm the intestines of people who do have a gluten intolerance. So there is no research that shows that a gluten-free diet can help you lose weight or that there's an added health benefit to having gluten-free products rather than your regular starches. So again, it's just really for if you have that intolerance or allergy.
Thanks.
You're welcome. Go
What's your
ahead.
take on raw foods?
I'm sorry?
What's your take on raw foods?
Raw foods. That's another diet that I hear of now, a raw food diet. As far as what though? Like fruits and vegetables or raw fruits and vegetables I think are good. Like I was promoting the for snacks throughout the day. It could be some raw fruits and vegetables to munch on. It depends if you have there's a medical condition or something where you really shouldn't be having raw fruits or vegetables because of any kind of intestinal problems or something like that. But if you're just looking for raw fruits, like the benefit of it, I think that's good. Other questions about nutrition? No? It's a quiet group. Usually I have a ton of hands up. Okay. Well, if, I don't know if you saw it, or there's, in your folders, if you do have questions, or if you're interested in seeing the dietitian, we do have an outpatient program at the hospital. There's a reference form in there with her contact information, so you can give her a call. We do go through insurance to see what's covered, so you don't have to pay out of pocket, or you might, depending on what your insurance covers. But if you are interested in seeing a dietitian, we do have one located at Lawrence Hospital right in Bronxville, just like 5 minutes from here. So, oh, sure.
I did have a question. I recently went to the vitamin shop to get vitamins, and I was told, and I hadn't been told this before, that when you take, most of the vitamins they take with food, the calcium, the vitamin D3, and I was told not to take 2 vitamins together because one counteracts the other. And I'm saying, well, if they say take them with lunch, I mean, how long's lunch? You're not going to eat lunch for an hour. You know, you take them together. And they said, no, it wasn't. One would counteract the other. What's your take on it?
Yeah, it depends on what exact vitamins that you are taking. They could have an interaction. That's why I said it's important if you are taking supplements that you follow up with your doctor because they don't know. Okay. Yeah, I mean, yes. Marianne was just saying you could take them throughout the day rather than taking them all at one time too. Right, so you could do it with your 3 meals, so breakfast, lunch, and dinner. So if you're
take them for breakfast and for lunch.
Take one for breakfast, one for lunch.
2 or 3 times a day. My doctor said take the calcium 3 times a day. So you're taking that 3 times a day. Well, you're taking some of your other vitamins with the meal too, because it's in. I just was curious. I had never heard this before. Not to.
Which 2 are you? Yeah, I want to know which 2 are the ones that are interacting.
D3, calcium.
No, they do D3
They go
and calcium
together.
They're together.
They go together. Yes. They come together.
They come together.
For absorption.
And if you find the vitamin D3 with calcium,
Yeah.
I only take it once a day.
Oh, I didn't know they had them together.
Yeah, you can find it. You don't have to take all these pills all day long.
What about omega-3 fatty acids and
The fish oil,
the fish oil, liquid oil, Q10, you can take them together?
Yeah.
as long as you're not taking Coumadin, then that's one of the. Then you don't take those vitamins.
Okay, I might have gotten wrong information.
Yeah, the calcium and the vitamin D, though, there's no interaction together. They actually do come together rather than having to take them separately.
And it's cheaper.
Yeah, I can imagine.
It's one pill.
It's one, instead of these.
Any other questions?
I just find that there's too much of an overload of different foods on the shelf and you're confused.
It is confusing. There's a lot, especially in the field of nutrition, it's confusing for myself because there's lots of different people now who are interested in nutrition. So everything that I say and what registered dietitians promote and what we tell you, not really promote, what we tell you and what we educate you on is all evidence-based. So anything that we say comes from the Academy of Nutrition and Dietetics, and it's all evidence and science-based. There's a lot of things that are out there that are claims and they're not evidence-based, and they get, you read it in the newspaper, you see it on talk shows, there's lots of people talking about nutrition, there's lots of health claims out there, and then it changes. So one day eggs are good for you, the next day you shouldn't have eggs. So it is confusing, but if you're really interested and concerned, definitely follow up with a dietitian because we can help you with that.
Thank you.
Welcome.
What do you think of multiple vitamins?
A regular multivitamin? My take on vitamins is that we should try to get as many of our nutrients from foods. There's lots of people who are unable to do that, whether it be from, they just can't eat as much anymore and they're not getting adequate nutrition, or there could be health conditions where they just need extra. But really, I think before taking anything again, you should follow up with your doctor or a dietitian to see if you really do need it. But I think, and what's shown is that getting your vitamins and your nutrients from your foods rather than having to go to a supplement is always best.
Any other? Oh, there we go, right there.
Someone told me that you should always eat the food, that vitamins don't do any good unless you're eating the food, like the Fred C with fruits.
Yeah, there is lots of people will say, oh, I take my vitamin in the morning and it gives me energy. Vitamins don't give us energy. They help you absorb what you're taking into your diet. So that is true. So that if you're not really eating, it helps you absorb what you're eating. So the vitamins don't give us that energy. It's the foods that we eat that give us energy, and the vitamin helps just to absorb that and give us the extra kick. Yeah.
Anyone else?
Yeah.
Okay. Thank you.
Thanks. Usually we don't get through as quickly, so usually I don't do a slide presentation, and I don't think I've done it in a very long time, but I thought it might be fun to show you a couple of slides of total joint replacement and talk to you a little bit about when you get to the point where, we'll just let them, yeah. Okay, so when you get to the point where we tell people that when you have pain that's waking you up at night, that pain that in your joints that is preventing you from enjoying your grandchildren, enjoying the walks in the park with your friends, going to the mall, doing the things that you like to do, that's a time that then you do need to think about maybe talking to your orthopedist about what your options are. So I always feel like at the end of this presentation, I'm really like the end of the road for you. I'm the joint coordinator. I'm an operating room nurse by history, and orthopedics was my specialty. So I love joint replacement because I see, and like I said, and I'm going to be 60 this year, I see my generation now is coming in for their hips and knees, and they have a whole new lease on life, literally. Their lives are starting over because they're getting these hip and knee replacements. So anyway, so let's see what we've got on the presentation, if there's anything good. And so here's a preview of our topics, which is the hip and knee anatomy, which I thought you might be interested in seeing, because I don't usually get to show that. we've talked about arthritis, so I'm not going to spend a lot of time on that. We all know what the signs and symptoms are. It hurts. And then there's conservative treatments for arthritis, which I will touch on, and the actual replacements, if we have time, we'll get to that. So this is the anatomy of the hip, and you can see that I don't have a pointer, but you can read it. The hip is actually, there's the pelvis, and then the femur. And the femur is the biggest bone in your body. And, well, I can show you here. So here's your pelvis, and then this is called the acetabulum. That's the socket in your joint, okay? And that's part of your pelvis. It's bone. And then this is the femur, and the head of the femur is like a ball. It's not like a ball, it is a ball. And in between the head of the femur and this acetabulum that's in your pelvis is your cartilage, if you still have it, okay? And there it is. I told you, I haven't done this presentation in a long time. This is the anatomy of the knee, which is, your kneecap is called the patella. It also gets arthritis. Nothing is safe. The femur is the, still that big long bone. It's called the distal portion of your femur, meaning away from your heart. And then the tibia is your shin bone. And behind the tibia is your fibula, which really doesn't do anything. It doesn't have anything to do with joint replacement. What you see in between the femur and the tibia is cartilage. Again, if you're lucky enough to have some. Okay, so they go into the condyles. What I always tell my patients in my class is just imagine what a chicken bone looks like. That's kind of what your knee looks like, okay? And they're rounded protrusions. And when they articulate with the tibia, meaning that it's talking to the tibia, it rocks. It's a smooth, nice motion when you have a healthy joint. And as it says, we all know that our upper body relies on our knees, okay, for support. So the knee cartilage is what covers our bones in the joints. It's a lubricating tissue. I told you it's about 80% water when we start out. It cushions and protects it. It's kind of spongy when you look at cartilage, and it provides that smooth and gliding surface. There's the hip cartilage, as I described, that's between the acetabulum and the head of the femur. And then there's the arthritis, which we know there's rheumatoid. There's actually over 100 different kinds of arthritis. Primarily what we see for hip and knee replacement, it would be rheumatoid or degenerative joint disease. Degenerative joint disease is also known as osteoarthritis, and that's from overuse. That's what a lot of us have. Rheumatoid is a little, it can cause a lot of deformities. Both can cause deformities. We also see for joint replacement something called avascular necrosis. If the blood supply is cut off to that joint, you would require joint replacement. So some of the symptoms of arthritis would be your joints are warm to the touch, you get swelling, you may get deformities. Some people go out, some people get knock-kneed. My mom was very knock-kneed from her joint disease. A lot of pain and immobility, stiffness, the decreased activity, your impaired lifestyle, as we talked about. It really does make, I'm sure a lot of you have pretty stiff joints when you get up in the morning. So getting a proper diagnosis is the first thing that you do, and usually what they want to do is an x-ray to see if you have any cartilage, okay? And it does determine the severity. This is what I wanted to get to, was we're going to see the replacement. So this is your normal healthy hip. On an x-ray you can see that there are no shadows on it, there's no extra tissue, what we call osteophytes. There's a nice space between the acetabulum and the femur, the head of the femur, and that is your cartilage. In the other x-ray, and that's not the worst joint that we've ever seen in the operating room, believe me, you see a lot of shadows at the head of the femur. These are the osteophytes. There's no space between the acetabulum and the head of the femur, so it's just grinding. When that patient was walking, just grinding into the hip. For the knee, and remember I talked about the fibula before, so this is your femur, this is a healthy knee. This is your shin, the tibia. That's that little fibula guy that hangs out behind. And then you've got the cartilage in between. So notice where the fibula is here. And then in this x-ray, you have a very big knee and lots of osteophytes. And then you have no space there
But what about here? You have a space. Do you think that that's cartilage? No, because where's the fibula in that x-ray?
Hanging out there.
That patient is bowling, and that's called a deformity. If you let your joints go far enough, they will deform. So the treatments are, as we talked about before, and I'm not going to be redundant, diet, exercise, medication, supplements, walkers and canes, rest and ice. I'm a big one on rest and ice and elevation. And then when should you consider it? Conservative treatments fail to provide the relief that you need. You have that diminished quality of life. And you've talked about it with your orthopedist. And you should get a couple of opinions. It's not a bad idea. And then you decide what's best for you. So we've talked about eliminating or reducing pain through exercise and diet. But in the end, if it's really affecting your entire life and you're just not enjoying yourselves, and it shouldn't be that way. We should all be as healthy and as productive and as active as we can remain. As I said, when people replace their joints, it makes a huge difference. It eliminates or completely reduces the pain. We actually, every Wednesday, I do a pre-op class at the hospital, and we give them something called a WOMAC, which is Western Ontario Medical, blah, blah, blah. And it scores the pain and the swelling and the stiffness that each of my patients have within the 48 hours prior to the class. And then we call them in 6 months, and then again in a year. And we compare their scores. We score them again. And I would say 95% of them after a year are without pain. And we see it because we do a total joint reunion every year. Up until Lake Isle shut down their kitchen, we were doing it there. And last year we had 150 patients come to see us at our joint reunion. We had live music and they were dancing, and I'm talking about people in their 90s. Remember the guy? Dancing. I mean, a little scary, but they were dancing. So, what I want to do is, I can go into all of the rest of this, but I have a feeling you probably have questions about like what the components of the implants are, and so if you have any questions, I would love to answer them and get off the PowerPoint. And nobody has any questions.
Question, yes, hold on.
Hi.
The material that's used in a knee replacement, the one that's used in a hip replacement, are they the same?
They can be. I mean, components are the same. You know, there's titanium. They use different metals. Yeah. Depending on the patient. For a hip, they might use, for the head of the femur, they might use a ceramic ball instead of a metal ball. But there's a lot of similarities in the actual composition of the implant, certainly not the structure of the implant.
And what is the statistics for having to have it replaced that it should wear?
Oh, how long they last?
How long they last.
You know, that's an interesting question, because it used to be, you know, when they really started doing lots and lots of replacements back in the late 80s, early 90s, I think they were saying about 10 years, maybe 15. But we're actually seeing people that they still have the same hip after 20 years. Wow. The hips that we're putting in now and the knees that we're putting in now, we're saying 20 years, so I suspect that they're going to last longer. And a lot of it has to do with what you do with your joint. So if you get new knees and you're out playing singles tennis like you're Arthur Ashe, oh, I'm really dating myself, right? You're going to wear out the cartilage there, that little polyethylene space between the tibia and the femur. You can wear out your new joint, but it just depends on what you do.
So you'd be advised to do regular exercise?
Well, we advise low impact, yeah.
Low impact.
Yeah, we don't advise, heavy step aerobics or singles tennis, but you certainly can play, doubles tennis, and you can play singles, I mean, it's up to you. What else? Golf. Golf is a big one, and if you think about it, golf, you really use your legs, you really use your knees, so that is something that's very safe, and if you replace the joints that were hurting, you can enjoy golf again.
Swimming.
Oh, swimming is just like the best overall exercise for like anything that ails you, as far as I'm concerned. I mean, swimming it's because you're suspended in the water, and so you have all of the support on your joints, your back, your neck, everywhere.
I had both of my knees replaced.
Good for you.
And my husband had his hip replaced about 25 years ago. He still got the same hip.
That's what I'm saying, right?
So he still has the same hip. I've had my knees One knee done about 5 years ago and the other one 3 years ago, and it's a big difference.
And tell me about your pain now in your knees after your surgery.
Well, the right knee, which I had done 5 years ago, I have very little pain. The left knee, sometimes I still have some pain, but then again this winter I fell and bent the knee behind it on the snow.
Oh, no.
So therefore that one started aching a little bit. But,
right.
And then the other day I fell up my stairs, landed on the knee. But over and all, I have no pain really.
Yeah.
I got drawers full of pain pills from before I had my surgery, and I hardly ever use them.
That's wonderful. Yeah, that's wonderful. Yes?
What's your thought on bike riding?
Bike riding is fine. It's, you know, I don't see any problem with bike riding because it's not high impact. Again, it depends on what you had replaced. Huh?
It's repetitive.
It's repetitive, so yeah.
Sit down.
Yeah, so you're talking about like at the gym, and it also would depend on how much resistance.
What is your time limit on that?
You know, I don't know. I really can't answer that question. I think your body tells you what your time limit is.
I'm 90 years old.
Well, God bless.
10 minutes a day.
10 minutes a day. On a new joint or an old joint? The joint you came with, or you have?
No problem. No problem whatsoever with my knees.
Well, that's awesome. So then, yeah, that's called genetics. You probably drank a lot of water growing up, and definitely genetics.
Actually, I was the first Western Union girl during World War II.
You were the first Western Union girl.
Bicycle. This is a sit-down bike, guys.
Yeah, no, I knew what you meant. I didn't think you were out on the hills of Tuckahoe.
Okay? And I don't know if you know about Old Army Road at Big Hill.
Yes, I know Old Army Road very well.
Right?
Yep.
So I attribute that to my well-being, really.
You're a beautiful lady, and God bless.
Thank you. Thank you.
Yes.
Is there a supplement one can take that will build cartilage?
No. No, there's a lot of myth out there, and I'm sure people would argue with me. I get patients that call our joint hotline asking me about gel injections. We don't do them. We don't believe that they help. You can get cortisone injections in a joint. If you're not ready to do the replacement, I have a very good friend who's exactly the same age. His knees are gone. He went for his first injection yesterday. It buys you some relief, but you can only have 3 cortisone injections in any particular joint, and that's it. You're done, because it starts to destroy the bone. So there really is, yeah, and then there's the, what do they call it, the glucosamine, I think it is. People take the supplement, and we've had conversations about that. We've researched it a little bit. You have to be sure that if you're taking glucosamine, it's the highest possible amount of glucosamines. It's very expensive, and there are products out there that are very low level. You're not getting what you think you're getting. Pardon?
How do you know you're getting the highest or lowest?
You would have to actually research it and look at what the milligram, how many milligrams, and you know, it's not something that I actually tell people to buy.
No, I did the gel injection for about 5 years on and off before I actually had my surgery.
How many of cortisone?
No, the
gel?
The gel.
You had the gel and that bought you some time?
Yeah, brought me about 5-6 years.
Good for you. Where did you go for the gel injection?
Well, I used to go to Doc Medical Group from my orthopedic doctor there was just.
Well, good for you. Anybody else with questions? You are a quiet group. Anybody else with joints already replaced? You had your hip done? And how's it feel? And you too? Good. All right, well then I guess if that's everybody got a packet, I hope? Yes. And we thank you so much for having us. I'm going to turn the mic over to Jennifer while I thank you.
So thanks again to the team from Lawrence Hospital, Marianne, Dolores, and Kim. Thanks again.
Thank you.